In Health Watch today, new information about a common breast cancer drug.
Also, many people are told they have to just live with chronic fatigue syndrome. Apparently not so. Dobie Henry here with more.
That's right. More and more doctors are really taking notice of this and trying hard to treat this. If chronic fatigue affects roughly 500,000 Americans, Epstein-Barr, which is very similar, falls under the umbrella of chronic fatigue syndrome. Many people with chronic fatigue are told they have to just live with it or it's all in their heads. But one doctor is on a mission to change that by changing patients' lives. Julia Moricelli suffered from one of the most common conditions in America.
By my late 20s, I just started to feel really, really ill.
And also one of the most misunderstood.
My family history is with thyroid, so they tested me and they just kept telling me I was fine, I was fine, I was fine.
But she wasn't fine at all.
Extreme fatigue to the point that no matter how much sleep you got, you didn't feel better. IBS, pain in my joints. And to the point that then hair loss started. I was told by 2 different doctors to go see a psychiatrist.
It took several years, several doctors, and several pounds gained, 40 to be exact, before Julia was finally diagnosed with chronic fatigue syndrome. Like many people, she thought she'd have to just live with it.
Hi, Julia.
Until she met Dr. Karima Hirani of the Hirani Wellness Center in Culver City. Dr. Hirani says chronic fatigue can be difficult to diagnose because the symptoms run the gamut, but patients don't have to just live with it.
When they come to me, we kind of look at the whole picture in these patients. We look at hormonal imbalances, we look at nutrition, and that's huge because most doctors don't really pay a lot of attention to their diets, and sometimes a lot of these people have really poor diet.
And for that, patients are given
a medical cleanse where we actually are giving them a powdered drink that contains herbs in it that have been scientifically studied to help detoxify the liver and detoxify the colon.
Dr. Hirani also looks at whether the thyroid is functioning properly. If not, symptoms can include
chronic fatigue, depression, even fibromyalgia, constipation, dry skin, weak fingernails, thinning of the hair, cold sensitivity. The TSH is a value that is obtained through a blood test, and the TSH is considered to be the gold standard for diagnosing hypothyroidism.
The problem is many doctors don't check the thyroid thoroughly enough.
Because their TSH is in the normal range, they're told that there's nothing wrong with their thyroid, go home.
But Dr. Hirani does what's called a subclinical hypothyroidism test.
If they fit the criteria for subclinical hypothyroidism, and even though their TSH is normal, I will treat them with thyroid hormone, and it can have profound benefits for these people. Profound.
Energy level is so much better.
Julia is being treated for an abnormal thyroid, low progesterone, and very low calcium. Her hair is growing back, and yes, she lost that excess weight.
In a matter of 2 months, my whole life is turned around.
Dr. Hirani says the ultimate goal is to boost the patient's immune system and make them hormonally balanced. She says other treatments that have also proven highly effective are vitamin B12 injections and the mega antioxidant known as glutathione. For more information on treating chronic fatigue, you can call Dr. Hirani at area code 310-577-0753. And again, that's 310-577-0753. Amazing work there. Well, finally, new information about the fight against breast cancer. Some researchers have found that the standard drug